if you only use topical creams, let's say for example, it's not really targeting on the root or what's happening inside the body. I've seen a lot of traumatic results, traumatic changes for patients started to intake tranexamic acid pills only for 1 month.
And melanocytes essentially is helping to kind of, it activates through heat, like sun, but that's our body's way of protecting ourselves from like sunburn, like skin cancer, all of that stuff. But when talking into like skin treatments, high heat, high energy treatments can cause activation of those melanocytes. And if we don't pre-treat patients, patients are more prone to what we call PIH, which is post-inflammatory hyperpigmentation. Prepping the skin with like really taking off that dead skin cell, like clearing out the clogged pores is very important. That way everything else we put on top of that, it's able to like just soak it in. It's like the things that you do on a daily basis, I think, is much more important. It has bigger impact than like just your once a month like treatments. If you're not consistent with it, then you're definitely not going to see results.
Hello everyone, welcome to our podcast channel. Today we're going to do a little bit of different things. I have Pauline joining us today. Great honor to seeing her here. She's a very well experienced aesthetic provider here with Plastic Surgery Center and for a long time of experience of injections, laser treatment, skin treatment designs.
Hi. And we have here Verana, which I'm very honored to be speaking with today. She is very well known and loved by our Costa Mesa patients. She's our consultant here. She has years and years of experience with us, assessing patients, good rapport with patients. But yeah, today, what are we going to be talking about?
So today we're going to go over our WAVE 6-step skin rejuvenation program over here. We've been doing this for years already, and today I would like to take this chance to really talk about what is this program and how does it work? Why do we develop it?
Yeah.
So everybody knows that people have different skin concerns based on skin conditions. Yeah. Yes. So in order to address and give a really thorough scientific assessment and then design a skin treatment plan, we came up with a 6-step skin rejuvenation program. So it is so much more complicated than people think of when talking about skin conditions and solving skin problem, because everybody's different.
Yeah.
So here we will be using an analogy of farming to really talk about like what we do here.
Make it simpler.
Yes, make it
simpler, more easier to understand for.
Of course, of how we understand the assessing patient, design the personalized treatment plan for them. So before talking about this, there's a little something that I need to be clarified is even like we have the 6 steps. Not everybody has to complete the 6 steps. Yeah. Some of the patient needs to, some of the patient doesn't need to, really based on their skin conditions. And we're going to be dive more into who is more of a good candidate for which steps.
And I think that's why it's so important to like assess, like do a deep dive of assessment onto someone's like skin condition, because like you said, not everyone's going to have the same problems. Some people probably would have to skip certain steps because it's just not something their skin needs at that moment. So yeah, let's go ahead and dive into the first one.
So the best thing that we have is we have a lot of technologies. We have a solid medical background, and we have top surgeons over here to develop like skincare regimens, compounding treatments. And when referring back to our analogy of farming, Visia machine is basically a technology tool that help us to better understand what conditions our soil is based before we do any planting. So the first step ever is going to be Visia.
Totally. It's just like when you're growing a garden, you kind of look at your soil first, see if it's ready for cultivating. Because if not, no matter what you do, things are not going to penetrate. It's not going to absorb anything.
It is a very important parts of during our consultation with patient it provides us a very comprehensive assessment result And we can use that report and utilize those kind of percentile to basically tell patient what is the condition that we're looking at, what are the reasons cause those conditions from happening, and what are we going to do. So I'm going to use one of the Visia report as an example of how it looks like. You can see there are 8 little categories and showing on different skin characteristics. For those 8 little categories, we have top 4 categories are focusing on what's happening on superficial layer of the patient's skin, and then bottom 4 are what's happening on deeper layer of the patient's skin. So for the VCA report, it is such a great tool for us to use. And even like during consultation, I believe like before treatment, after treatment, it's also a great tool for you to use to show patients their progress, and then what changes on their skin condition, what we'll be doing for the next step.
Yeah, because like throughout the year, your skin like will change. It'll vary, right? And then after each treatment, we do check on their progress, and we use the Visia tool to like really assess like, okay, we probably need to go a little bit more aggressive or add more of something in their skin regimen or something, just to like really optimize their result.
Yes, we're all beneficial from the Visia machine a lot.
Visia machine is literally like in every step of our like the patient's like treatments.
So we have to make sure that our skin is ready for any kind of medical treatment to be penetrated into the deeper layer of the skin. So that goes to choosing right type of the facial treatment. A lot of people will feel like facial treatment is just a superficial layer, relaxing activities treatment over
it's
there.
It's like a little treat is what people think of it, but it's more than that. Yeah.
So basically what facial do is actually to making sure the patient's skin condition is on a normal pH level. Yeah, a healthy skin that can absorb more ingredients, nutrient is at a weak acid pH level, which we have to make sure that happens first before committing with any other medical treatment. So here, usually what we talk about is hydrofacial and Verana facial, and
those
we
are
have
kind of like
more.
Our basics,
Of course, yes.
Basically.
Yes, and we have more choice of, medical grade I-cured facial over here that basically suit for all skin types, for sensitive or non-sensitive skins. So for patient who has more oily skins, then they have clogged pores and acne, we do recommend them to do some facial that includes some acid in it, like for cleaning purposes, like hydrofacials. Okay, and then for patient who has like dry skins, and then their skin recovery speed is slower than others, usually a Velmont facial, I-cured facial, or cell awakening facial can also help. And something interesting that I found during our daily practice is a lot of times when you're performing more intensive medical treatment, the scheduling a facial on the same day of the medical treatment really helps with deliver the optimal result. Yes,
it's like sandwiching the treatment, like doing the facial and then doing the treatment, like our laser treatments, and then doing the mask afterwards. I think patients are much more happier when they leave the office because they're not like super inflamed, like their skin's not burning and stuff like that. I think it's very essential, very crucial.
We do see a lot of good result from how we're scheduling like that. Yes, and
that's just years and years of experience too. We find that like coupling these treatments together just really give patients the better results. And you touched on the pH level, right? So as you said, like normally the skin's pH is around like on the weaker acid. And pH is really important because it affects like the absorption and distribution of not only products but the treatments that we're going to do moving forward from then on. And then I think we're going to touch base with cure peel as well, right? That's kind of in combination with our facials, and then peel is also very important. So
Yes.
Would you like to talk a little bit more about our peels?
Yes, so after the facial treatment, our skin condition is under a more cultivated moisture and luster condition that's ready for the next steps. So here comes the next step of the cure peel. The cure peel is a peel treatment that combines different acids. Yes, so it is like other chemical peels in the market, but not the same as the other chemical peels in the market right now. So here at Wave, we are basically choosing all medical grade, more advanced acid into our peel treatment. We do have a lot of our varieties of types of acid to choose from, targeting on different skin conditions. And a lot of times peels are really a on like underestimate treatment there, I feel like. So it's not only about peeling, it's more about really deeply, help with skin cell turnover, and then peeling out a lot of like bacteria, inflammations from the clogged
That we
pores.
can't get just from simple exfoliation, right? Yeah. Deeper exfoliating, like you said, that skin turnover is really essential. We can't just get that with just regular skincare.
Of course, and it's very important to do the peel before any intensive medical treatment.
Okay, so just kind of going back into our analogy of farming, if your pores have a lot of like, like gunks and like stuff on the top of dead skin cell, it's hard for the crops and like the fertilizers to really go deeper into the skin, right? So prepping the skin with like really taking off that dead skin cell, like clearing out the clogged pores is very important. That way everything else we put on top of that, it's able to like just soak it in.
Oh, of course. Have you ever done peel on yourself
I
before?
have. It's actually one of my like favorite treatments of all time. It's so underrated, but like yeah, there's downtime, like you do have like pretty, or at least for me, I get like pretty aggressive peels. I literally I look like a snake like walking around. But I mean, after 7 days, I have like baby soft like skin, and I just like, have you done it?
Yes, I've done it. I've seen a lot of patients done it, and I do feel like for some of the patient they do peel a lot. Some of the patient doesn't peel so much. So
Peeling itself is not necessarily a clinical endpoint, and this is, if your experience with peels, that is the truth. But just setting expectations with patients is pretty important too.
yes, I agree with that. I agree with that. So usually after you've done the cure peel, your skin is ready for the next intensive treatment.
Yes, more
And
invasive
more
treatments.
invasive treatment. And just like your soil is loosened and is hydrated already, so it's ready for some energy treatment for the next step. So the next step that we're talking about is basically involving like energy treatment, like radio frequency microneedling, like Morpheus 8, Fractora, or microneedling without energy base.
Yeah.
So on this part, then we need to go back to the pre-treat, the importance of the pre-treat for radio frequency microneedling, because it involves the radio frequency energy. So for patient who is skin type 456 who's prone to hyperpigmentations, that's where we mentioned how important to use medical grade compounding products, medical grade skincare treatment at home to really control the melanocycle.
Correct.
Yes.
So the pre-treatment that we are talking about, there's different levels to it kind of too, right? So there's a tranexamic acid and there's a hydroquinone. Hydroquinone is essentially helping like kind of suppress the activity of melanocytes. So when we do the treatment, like radiofrequency treatments such as Morpheus 8 or Factora, it helps kind of like neutralize and just calm down the melanocytes so we don't develop what we call the post-inflammatory hyperpigmentation. Um, there are other things that we do as well, like the tranexamic pills. I don't know if you want to dive into that today, but
That's actually my favorite pills because of what's happening outside is a lot of times it's because the hormone inside is imbalancing. So if you only use topical creams, let's say for example, it's not really targeting on the root or what's happening inside the body. So I've seen a lot of traumatic results, traumatic changes for patients started to intake tranexamic acid pills only for 1 month.
That's crazy. I have seen like our patients, the ones that you've put on that, they love it.
Also, so in their journey with us, they do gradually see their skin condition to getting better and better, which helps them to build up more confidence towards the long journey. Yeah. So let's go back to the radiofrequency microneedling and microneedling. So I know that there are a lot of radiofrequency microneedling machines over there. Yeah, we have Fractora with Morpheus 8, and based on your experience, how do you usually recommend patients to choose either Morpheus and Fractora? Before talking about that, I would like to get some information, but before talking about that, the reason why we designed this step to use radiofrequency microneedling is because a lot of times when patient has deeper pigmentation, deeper inflammations, cure peel is not that deep, cannot be reaching out that deep to clear out all the inflammation. That's why we're implementing radiofrequency microneedling that has energy on it. So back to the topic, if there is a patient over there and then he or she is ready for radiofrequency microneedling, how do you make recommendations?
So, the skin assessment is very important, first of all. We kind of assess how deep are these, like, pigments or like inflammation and stuff like that. From experience, patient who has more of a deep, like, pitted acne scarring, like people that had like cystic acne in the past and now they're trying to like just get their texture a little bit better. Fractora, I think, works better for patients with deep like pitted acne scarring. Morpheus 8 is what we call as a radiofrequency microneedling. So it helps, there's different depths to it. So I'm able to target like more superficial or deeper depending on what the patient needs, right? So I would say Morpheus 8 is more for patients that want a little bit more of that tightening. I can also burn a little bit of fat with that depending on my, energy level, but also helps with just like fine lines, wrinkles, like, more texture, like base stuff. So like I said, Fractora is more for deeper acne scarring, and then Morpheus is more just tightening and more superficial things, I would say.
But Morpheus it also help with
it does help with acne
scars.
I just feel like Fractora could be a little bit more
aggressive with
it.
So. Yes.
But if your goal is for overall just rejuvenation, lifting, tightening, I would probably go with Morpheus 8, and then later on I would probably like have them do Fractora if they want to just do more focused on like some patients will have more right around here, and then I would recommend Fractora on top of that.
Yes.
Yeah.
And besides radiofrequency microneedling, like I do see some of the patient who does not have so much of the inflammations underneath their skin, but they are they're bothered by their bigger pores, things like that. So something that I do need to talk about is our microneedling right now combines with some exosomes. Yes, and brightening solutions.
I love it.
I tried that one time, and then the exosome really helps with skin recovery and then shrinking the pores.
And there's a ton of like growth factors in it. That's why it helps with the healing, but also helping with collagen boost, like boosting collagen production. So I love it.
Yes. And imagine that you're performing those kind of ingredients and energy treatment on hydrated, like pH level very normal skin type, and then also very clean based skin conditions. Will have dramatic results coming out.
I mean, imagine if you have like all this dead skin cell on your face, a lot of like clogged pores. When you do the microneedling, you're really just taking off those layers, right? But you're not able to like really go in deeper and really get like that optimal result. So that's why we have like steps in place to really ensure that this is the best way to do it.
Make sure it works.
Yeah, exactly.
So now after radiofrequency microneedling or microneedling, that our soil is so ready, like well moisturized, loosened, and then ready for everything. So right now, the next step, if we go back to our farmland analogy, is to fertilizing and then putting all the nutrients in it. So this step is what we call it hydroinjection. So Pauline, I have another question for you. Okay. So have you ever heard about anybody talking about skin boosters right now?
Yeah, I feel like if you're on the internet, I'm sure you have seen people talking about it. Essentially, what I know about skin boosters is that it helps like with collagen production, helping with moisture and stuff. We have our own version of that, and I think it's something that we have time and time again perfected over the years of Wave. We have taken ingredients out, we've added on stuff, we've really perfected this. But essentially, I'm sorry. Our hydroinjection is it's our version
of skin booster. Yes.
And we've been doing this for a long time, right? And we perfected this, like I said. In our hydroinjection, we have a lot of brightening agents, vitamin C, we have glutathione. I'm not going to go into that with what exactly is inside, because that's our secret.
That's our secret.
But yeah, like brightening agents like vitamin C, glutathione is on there. We also have hyaluronic acid that helps with just drawing more moisture into the skin, making your skin look a little bit more plump, kind of like the skin booster. We also have neuromodulators in there that, when applied more
skin tightening purposes.
Epidermis. It just helps with tightening the skin, helps with wrinkles, your pores, shrinking your pores. But yeah, it's such a good like cocktail, and I think a lot of our patients
loves it.
Yeah, they come back for it like time and time again. So
yes.
It's a testament of how well our skin booster hydroinjection
of
works.
Course.
Yeah.
For my patient, among a lot of like consultation I've done and then treatment plan that I've done for patient, our hydroinjection is our star treatment. One of the star treatment over here, because a lot of patient will feel like our cocktail really makes their skin to show glowy, effective, and their skin looks more plumped. So that's something, of course, it's been done on, prepared skin. Their skin is really ready for those nutrients to coming in.
I think also what sets us apart from other places, because I've had patients that say, oh yeah, I've tried hydroinjection in like a different clinic, but don't see much results. So they feel kind of discouraged to like, yeah, exactly. But our glutathione, we have a pharmacy that does it for us, I believe. But knowing how to handle these ingredients is very important. So at least for us, there's like a 30-minute window when, with the glutathione until like the effectiveness or the potency of it like kind of goes away. So for us, we always ensure that that's prepped 30 minutes or within that 30 minutes of like using it for patients.
Yeah, that's one of the key points that
totally.
we do here. And also the pharmacy that we have here are FDA regulated pharmacies.
Very important. Those are all.
Yes, every little details.
Every detail is like literally thought of, and everything's regulated.
Myself is also I'm the consultant over here, and I myself is also a patient over here.
I mean,
so
same.
I do yeah, same.
Because I believe in like what we do for our patients. If I don't, then I wouldn't be doing our treatments as well.
So we know how detailed and well prepared we are. Okay, so after hydroinjection, it is time for us to do pest control.
More like maintaining, right? And like the skincare rejuvenation thing is maintaining.
Yes, maintaining and protect our skin from being from the erosions. Yes. So now we're talking about pigmentations. Pigmentations, a lot of times our melanocytes are coming out after sun exposure,
especially summertime.
especially summertime, to
around
protect
summertime.
our DNA in ourselves, in our cells,
It's our body's way of like protecting ourselves.
ourselves.
But in turn, we get brown spots.
Pigmentation, brown spots and sunspots. So that's why on the Visia report we have UV spots and brown spots all showing on over there, just to show like in which degree that
How deep is this?
how
pigment?
deep it,
Exactly.
yes,
Yeah.
exactly. So how do you usually choose the laser treatment between Lumeka and Pico 4?
That's a really good question because from just like naked eye looking at a person, it's hard to determine if this is a deeper pigment or if it's just a superficial pigment, right? Like on our Visia, there's a category we call spots. Spots is more like what we see with our naked eye, exactly. UV spot is the deeper, and then the deepest one I would say would be our brown spots, right? So patients who score lower on the brown spots, I would say they are more, I would go towards Pico 4 treatment. And more for patients that have like just sunspots, I would go for IPL or Lumeka. If you actually interchange the two treatments, if a patient has melasma and you treat them with Lumeka, it can actually flare up and bring those pigments up to the surface and make it worse.
Yeah, one key point that we're talking about right now is the biggest trigger of the brown spots, which is heat. Yes. So if you see the different type of machine using different type of energy, Pico 4 laser is actually use a picosecond.
Yes, picosecond.
Yes, and then IPL light is deeper and it's like not so bright. And then for IPL light, it's more brighter, mimicking sunlight.
Yes.
So in that treatment room, you can see like bright light over there.
We have to wear our protective glasses.
Of course, yes.
Yeah.
So it is really important to choose the right laser treatment to prevent PIH. And again, re-emphasize the importance of pre-treat before the treatment. A lot of times, I do see patients has a combination of pigmentations on their skin, so they might need to combine the Pico 4 laser treatment, especially with IPL treatment.
At least for me, I prefer patients to do Pico first, and then kind of like brown spots, and then I go in with IPL like probably more towards the end of their treatment, just to really target whatever is left.
Yeah, and a lot of times for some patients, after the Pico 4 treatment, Pure really helps. Again, yes, for superficial layer of the pigmentation. So that's how we talk about, like, we need to customize and personalize patients' treatment plans based on those, Visia report, and then based on their skin reactions, based on the specific skin conditions.
And I think that's what sets Wave apart from like all the other places, is that we have a lot of tools in our toolbox, right? And that like everyone is so diverse, everyone's so different in terms of what their skin needs, but we have all the tools in our toolbox to like really like target specific things for each patient.
Yes.
Yes,
that also goes to our skincare regimen.
Totally.
I don't know. I think you've seen our skincare regimen.
Of course.
List.
I think I have. In the beginning, I definitely was on that.
Yes.
Long list.
Long list for AM and PM.
But it works.
It works, and like luckily we have the medical grade brand to choose for in a combination of different high concentrated ingredients and nutrients, to choose from. And
I have a question for you, Verana.
Yeah, of course.
So I've had patients ask me, I have this, skincare. They're over the counter. But why do I have to use a medical skin grade product over the counter products? What's the difference?
That's a very good question, actually. So the difference between medical grade skincare products versus over the counter products, one major thing is, like for over the counter skincare products, you can just go there and purchase and then go back home. It doesn't have so much of the high concentration of medical grade nutrients ingredient inside. Let's say, for example, very easy to understand, like for vitamin C, there are a lot of brands over the counter that has vitamin C ingredients in it. Some of the vitamin C, when patients use that, their skin turns to be drier
or irritated.
or irritated. Yes. But for us, we have 20% vitamin C serum that is dry oil based that contains a lot of other high concentration ingredients inside to make sure that when you're using high concentration vitamin C together with other ingredient that we have medical grade, your skin leaves moisturized and hydrated. So that's something that is different from over the counter medical grade. Another difference is, for medical grade skincare products, really there are some regimen over there for you to follow. There's never one product you use and then it shows magical result, and it's always a combination. So you do see great result from medical grade skincare treatment, skincare products, rather than over the counter skincare products, because of the high concentration, because of scientific regimen designed only for your skin
and it's
type.
actually studied for its efficacy and all of that stuff. The over the counter, there's a reason why it's so easy for everyone to get over the counter like skincare products, is because the concentration, like you said, is not as high, so the risk of like adverse reactions is much less. But also that means that it's not as effective as like medical skin grade products. So that's, I think, the main difference, right?
That's the main difference. And for the iCure and medical skincare products that we use, all the ingredients are FDA approved, and then they're from a very good manufacturer that is also FDA approved.
And another telltale sign that it works is that I think all of our staff are on this.
Yes.
Literally every single one is
Yes.
on some kind of iCure like skincare.
Yes, so basically we know how it works
Exactly.
and how effective
And
it
then
is,
that's why
yes.
it's easier for us to like recommend it to patients, because we ourselves have used it before. And just to reiterate, like not all patients need to follow like every single
Everything.
step, right? Some people might have like already does like facials and peels like more on a regular basis, so we can definitely skip that step, right?
Yeah.
Or patients that don't have pigments to worry
Yes.
about, then we can skip that step as well.
Yes, and one thing is also important is knowing what patient's expectation and concern is, because I do see some of the patient they're like they like pigmentation. I mean, some freckles things over there. So if it's not their concern, they don't have expectation, then we don't have to do that. Yeah.
Exactly.
So it's all because it's all patient centered. Well, at the end of the day, we have to really understand what end result that patient is looking for, combined with the in-depth comprehensive assessment.
And I just would like to add too, like on top of like, when you do Botox and fillers, I feel like that's super like important. I mean, not important, but like people come in for like treatments for Botox and fillers a lot. But if your canvas is not good, meaning your skincare is not in place, you have a lot of texture, your skin still, no matter how much fillers, no matter how much Botox we use, it's not gonna like get you that
Yes.
final like result,
Wow result.
Exactly.
Yeah.
It's more of an addition.
Yes.
Unfortunately, there's no one treatment that is able to do
Does
all.
everything.
If
Yes.
that's the case, then
Of course, I
no.
do see sometimes, patients feel like, oh, I have hollowness on my face in these certain areas. And it's actually, pigmentations over there. Or like, it looks like indentations or looks like shadows over there. It's actually mild shadowing over there. So we're just going like different directions if we're doing more and more fillers in it. So it really helps with us and with patient to really understand what addresses their main concern, what can be done to address their main concern. So I think it really helps. Like it doesn't matter if it's for treatment wise or for consultation wise. Okay. All right.
This has been really good.
It's pretty informative. Thank you so much for joining me.
Thank you so much. I mean, in the clinic, we work really close together. We collaborate on like what treatments patients will need. So this is nice to like be able to sit down and like really like break
Talk
it
about
down.
the logic. Yeah. The logic is very important.
Very important. Yeah.
Yes.
For patients to know like the why we do the things we do. It's breaking it down is much more simpler for them. But yeah.
Yes, of course. Okay, so thank you so much for watching our podcast, and we look forward to see you next time.
Bye.
Bye.